Hello, everyone. Good afternoon again for joining us for Medicare Mondays. My name is Dr. Prince Bewa, and we are very excited again to pick up Medicare Mondays. We started last week with our Medicare Mondays, and today we are here again in the studio with Ruthland, picking up on where we started from last week, going over Part D, and today we are going over in Part C. And we thank you all so much for taking the time to join us. It's been incredible time spending and learning because the annual open enrollment is almost here. Yeah, today's the 7th, so it's almost here. I think it's the 15th, right? So
Yes.
it's about a week and a day. So we thank you all for joining us today and learning, and we hope that your time with us will be worth it. And I'll pass it on to Ruslan to talk more about herself and also with her organization. Sorry, I am with the Hughes Academy, the Hughes Academy, and we are learning and making sure that our health system knowledge is easily accessible and understandable to as many as we can. So I'll pass it on to Ruslan to introduce herself and also with her organization.
Hello, everyone. Good evening again. And Prince, it's always a pleasure to see you and to be doing this with you. Folks, my name is Ruthlyn Noel Joseph. I am the founder and president of HealthWiz Solutions. We're a licensed insurance agency based in New York, but work with individuals across multiple states. We are both my agency, my agents, and myself are certified brokers who works with individuals in navigating Medicare. We're both appointed with many of the carriers as well to really just guide the individuals and making sure that they make the right choices when it comes to their Medicare. Um, we work with a number of other products as well, but that's not too important for today because we want to focus on the health aspects of what we're doing. And I know you're eager to learn a little bit more about all of the changes that's coming down the pike for 2025.
Thank you so much, Ruslan, for joining us. And always is a delight to do this with you, to for you to share your knowledge with us. And thank you for being generous with your knowledge and being generous with your time. And we sincerely appreciate you for that. So, without taking much more time, we also want to acknowledge this year we are hosting our Medicare Mondays with the African Immigrant Dream sorry, organization that is also a sponsor with us. And also we have the Ottawa channel who is also picking this feed and also broadcasting to as many audience as possible. So we appreciate all the time and all the support. And you can watch us on Facebook, on LinkedIn, and also on YouTube. We are so as we go through today, if you have any question, any pending questions that come to mind either from last week or from today's, please do not hesitate to put your question in the chat, either on Facebook, on LinkedIn, or on YouTube, and we'll get it here. We'll answer them, and if we are unable to answer it here, we will pick up next week, and next week is going to be a last one, Ruthlin. Yeah, for this year, and we can follow up appropriately with you. So thank you again. We will pass on and move on to today's. Actually, today we are looking at Medicare Part C mostly. Last week we looked at Part D. So we are as we look into the 2025 plan changes, we want to discuss that today on the Part C side, which is the Medicare Advantage. So that is our focus for today. And we'll do a quick review of last week's. Last week we looked at Part D, which is the prescription drugs. And if you have forgotten, we had talked last year about the different pathways that Medicare you can choose, right? The traditional Medicare, which is pathway A, and mostly has part A and B, and then the Medicare Advantage, which is the pathway B, and with that one you have Part C, and then you have Part D, which is the prescription drug. Did I miss anything, Ruthlyn?
Um, I just Partway A and B
Mm-hmm.
with the standalone prescription drugs. That's original Medicare.
Medicare, yeah, and then the part
Part
MAPD,
C,
C, yeah, go
right?
deal with it. So last week we looked at Part D specific changes, and if you have you missed the session last week, we will encourage you to watch the video. It's on YouTube and on Facebook on the Heals Academy, and I think Ruthven also posted on the Healthway Solutions links as well, pages as well. So you can please watch those and refresh yourself for the changes that we talked about on the Part D side last week. And today we'll be picking up on the Part C, which is the Medicare Advantage changes for 2025. And next week we will end our Medicare Monday sessions as we have been learning this for this year. So we hope by next week you have at least a better idea of the changes and the things that you need to do as you prepare for the open enrollment season that is upcoming. It's opening next week, going on. So we will. Our goal today is to go through three important changes to watch for in 2025 in Part C in the Medicare Advantage um, area, and we hope that by the end of the session, our conversation, our discussion, that you have those down pack for that. Want to talk about annual enrollment, and Ruthlyn, do you want to touch us on the annual enrollment period coming up?
Certainly. Okay, folks. So the annual enrollment period. This is your once a year opportunity where you could make whatever changes you need to your Medicare plan, right? So it's your open enrollment for Medicare, and some people do call it Medicare open enrollment. But during this time frame, which runs from October 15th through December 7th, you're going to make changes to your plans, and those will take effect starting January 1st of 2025. And that's because Medicare Advantage as well as Part D plans resets every year. So when December 31st hits, come January 1st, you start a new plan year with those plans. So this is where your opportunity, and with all of the changes happening this year, we're going to highly encourage you, and you're going to hear me telling you to do that quite a bit throughout this presentation, is to let you know to at least focus on reviewing your benefits this year to make sure that it's going to be working for you in 2025.
Yep. And if you are confused about what annual enrollment period is, we discussed that last year, and even looking at all the other enrollment periods. So definitely, there are a lot of resources that are out there to help you catch up and also know what you need to do. Um, why are we doing what we're doing? I think there is a great opportunity for us this time because we have just a couple graphs to just show and the Kaiser Family Foundation published this, that more than half of eligible Medicare beneficiaries are enrolled in Medicare Advantage as of 2024, and I wouldn't be surprised that 2025 will even be more. So, with the population that we are targeting, either with the immigrant population or the African American population or minority population, this space and the things that we are discussing, especially today, is very relevant because a greater proportion of Medicare enrollees within that population are enrolled in Medicare Advantage, and this make it this session even much more important and very needed. And Ruthlyn, it is even projected by the Congressional Budget Office that by 2023, you can just see here on the chart, like 64% of all Medicare enrollees will be in Medicare Advantage. So
Right.
what we are doing is very important. And it just set a foundation. Either you are a Medicare beneficiary now, or you are getting there, or you are in this sandwich population where you have your parents to take care of your kids, and you are trying to juggle all these things. At least that now that there is annual enrollment period, you are probably trying to figure out your own insurance with you and your family, and also helping your parents in that regard. So this is very important. Or even if you are just learning it, so that you are used to Medicare, you are used to Medicare right now, because by the time you get there, you don't want it to be a surprise to you. But
Right.
at least you know there are several changes that are happening, but at least you are familiar. You just don't get to 65 or 66 or whenever you are eligible, and then you are now asking yourself, what is Medicare? And it doesn't help. The earlier you know it, the better it will help you in your decision and your preparation towards that. Do you want to add anything to that?
And I think the key piece here is that it's the education, right? You're learning before you need it.
Yeah.
And know that there are different approaches, and any approach could work for you. I'm not one of those agents or brokers who say choose a Medicare supplement and don't bother with the Medicare Advantage, because I believe that either will work well for any person, but you got to look at your bottom line, and not everything is right for everyone.
Yeah. 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 And one thing too that I learned from this report with the Better Medicare Alliance, I have a report out there, and this was published in July 2023, and they were looking at the demographics of Medicare Advantage enrollees, and they are asking how do they differ from fee-for-service Medicare enrollees. And
Mhm.
some of the things that you see here: Black and Latino beneficiaries enroll in Medicare Advantage at higher rate. Latino beneficiaries are the most likely to enroll in Medicare Advantage, followed by Black and Asian beneficiaries. In the Medicare Advantage, 27 of the enrollees are Black, Latino, or Asian, compared to 17 in fee for service,
Mm.
right? And then even looking at the social economic needs across race and ethnicity, a greater proportion of Medicare Advantage enrollees report low incomes and low high school graduate rate than those in fee for service. So you can just see the population that are being enrolled in MA or Medicare Advantage, and the need for such an education, because with that low income, low education from a regular academic education, they need much more help. Definitely, there is much more help and much more need in making sure that whenever people, as you said, people are making that choice, they know what they are choosing, they know
Mhm.
their bottom line, they know what their need is, and therefore not necessarily that it's a Medicare Advantage and therefore I choose, or it's fee for service and therefore I choose, but definitely people making informed and intelligent choices, not only to choose but also to use the service, right? They use
Right.
the service that they have signed up, and they're getting, the plans are getting paid to provide necessary services to improve their health overall. And that is the reason for what we are doing. And I saw this and I wanted to pull it out. Yeah, I don't know if you have any observations, anything about these observations.
Well, well, it supports my theory that I have. It's not scientific, but it supports my theory that I have, is that obviously, if more low income individuals, it's a cost factor for them. And
Okay.
with Medicare, original Medicare with a Medicare supplement versus Medicare Advantage,
Manage.
is a shifting of the cost. With
Uh-huh.
Medicare supplement, you're paying the cost on the front end, so you do pay higher prices. Whereas with Medicare Advantage, you're paying the cost on the back end in
Hmm.
copays and co-insurances, right? But you could get much lower monthly premium plans. And
Yeah.
so for that population, there might be questions they're asking themselves is, how sick am I? And do I really need to spend a lot of money up front and
Right.
I may never use it, right?
Yeah.
And that's probably what's happening here. That's why you're seeing the numbers, because you don't have a lot of, you know, extra money to move around. So they're trying to make the plan work as best as they could.
Yeah. Yeah. Thank you so much. So we will pick up from a review from last week, if you don't mind taking us quickly through last week's,
Okay.
and then we can pick up from today's.
Got it. Got it. So last week we spoke about for Part D individuals, we spoke about the out of pocket costs going down, and that there is a cap. So for 2025, the most individuals are going to spend on prescription drug costs is $2,000, which is great news for the consumer, especially if you're someone that has high cost medications and you've been getting into what's called a donut hole or the coverage gap, where you have to spend almost $5,000 to, and once you enter the coverage gap period, but you had like $8,000 really in catastrophic coverage before the plan starts paying 100% for you of the cost,
Mhm.
right? So so what this whole idea of the standalone prescription drug plans is that once you hit $2,000, no more donut hole, right? That goes away. You've spent your $5,000 to enter the donut hole. You're in the donut hole until you're $8,000 in 2024. That all
Mhm.
goes away. Now, what you have is you pay your deductible, which could be up to $590 for 2025. So you're paying the deductible. Then once you enter the deductible, you're going into what's called the initial coverage phase. And once you enter and you've spent $2,000, you're in what's called catastrophic coverage. That's for 2025,
Okay.
right?
Yeah.
So it's good for the consumer,
Yeah. Yeah.
right?
Um, then I think you touched on the donut hole.
And I
So
did touch about it here because it's one of it, they all tie together,
yeah.
right?
Yeah. Yeah. So I know our time is running quickly and we have a lot of information for today in terms of what the Part C offers us. So I will pass it on. And as we go through Part C, do you mind giving us just a little bit of just about if someone asks you, Ruthlin, what is Medicare Part C? And then
Okay.
we can quickly go deeper into the 2025 changes.
Okay. So, and in layman's term,
Mhm.
Medicare Part C is Medicare coverage that you get from a health plan who has a contract with Medicare.
Okay.
That's what it is, right? Now, the Part C plans are most comparable to what many people have now when they're coming out, when they're in an employer plan, for example. You
Okay.
recognize those by because they have what's called a PPO, which is a
Okay.
preferred provider organizational plan. You recognize it with an HMO, preferred health maintenance organization plans, and those two things mean very different things for individuals. But it's still Medicare coverage because I know a lot of folks say, Prince, oh, it's not Medicare. It is Medicare coverage. Part C plans must cover all of the coverage that someone would get on the Medicare Part A as well as Part B. But then
Okay.
they add all these extra benefits, your dental, your vision, transportation, and a whole host of other extra benefits for individuals.
Okay. So pretty much it's kind of like you're living what you have at your job, but
Right, right,
Medicaid and Medicare like that.
correct,
But you have a private company in the middle and you
correct.
and as
And
opposed to traditional Medicare, which is directly with the government, you have your
correct.
red, blue, and white card. Uh,
Mm-hmm.
and you probably have another card that is more from a
The
private.
carrier, it will have the name of the carrier on it. It will have whether it's an HMO or PPO or some other designation. It will tell you what you're going to pay out of pockets for your premiums. What you're
Mhm.
gonna not for your premiums. It's going to tell you about your copays, what you're going to pay for. And I think why we're seeing the shift is because so many baby boomers, when you think about it, that's coming into Medicare now. They're used to having an HMO or a PPO plan. They're used to having health insurance companies manage their cares,
Yeah,
right?
yeah.
And that's how Medicare Part C works. No different. It's just that the insurance company is going to manage your care.
Okay. Okay. Thank you so much for that just on that. And so tell us more about the now is all for you now, like with the changes that are coming up that our audience needs to be ready for.
Okay, so one of the changes that's happening this year is that individuals are going to see, starting next July, they're going to see what's called a mid year notification from the insurance carriers. And a lot of this has to do with if you're sitting at your television right now, you're probably seeing a lot of advertising about Medicare and get your OTC benefits and get dental and vision. So all of these under the Medicare Advantage plans are called extra benefits, right?
Okay.
And so the government basically said, okay, we know the Medicare Advantage plans are offering all these extra benefits. We also know that a lot of consumers are not maximizing their benefits.
Huh.
So come 2025, come July next year, individuals are going to get a notice from their plans telling them basically where they are in using their benefits. So if you have $1,500 worth of dental benefits and you didn't use any of it, you're going to get this little notice that says you have these unused portions of your benefits to take advantage of. And then the carriers themselves, they're going to have to guide you to how to access those benefits. From a agency working with Medicare, those are things that we would help our customers with already because we want them to be using their benefits.
Huh.
But a lot of people are not using it. So you're going to see this notice and you're going to get some help to use it. And very likely, you're going to get some, you might also be hearing from your broker, whoever you're working with, letting you know that you haven't used any benefits. Are you having any problems? Do you need help setting up your online account? Or do you know you have dental? Do you need to make an appointment with a dentist? Do you want us to help find you a dentist, find you a vision expert? You know, you have gym membership. Do you know how to sign up to get your gym membership? You're going to get probably some hand holding, not just from the carriers, but from the brokers as well moving forward in that.
Okay. So just you mentioned extra benefits.
Correct.
So these are benefits that are extra to the part A and B, or
Extra to
these are
part
part
A
of
and
that?
B, right?
Okay.
So
Okay.
your traditional part Medicare plan, traditional original Medicare
Okay.
covers, you know, your hospital costs and it covers your medical benefits. They don't traditionally cover dental, especially if you need to see a major dental work to be done that's non-medical. They
Mhm.
do not cover vision. They do not cover transportation. Those are things that traditional Medicare does not cover. So they're called extra benefits because they're extra to the regular stuff that Medicare has to cover under A and B.
Okay. So is the extra benefits the same terminology that is used for supplemental benefits? Is it the same if people are using that same term?
Um, yes.
Okay.
I
Okay.
think it's at different ways that people are. It's extra in the sense, but it's extra supplemental benefits. I
Okay.
don't like using supplemental benefits, although I entered it. But because here's what folks get confused about:
Okay.
when we say supplemental benefits, folks tend to confuse that terminology with Medicare supplement.
Okay.
Right? And Medicare supplement is something very different. Medicare supplement only pays the cost for your Part A and Part B when you're on the original Medicare. So just treat it as extra benefits. Know that your Medicare Advantage plans have to cover your benefits that you would normally get on the original A, which is all your hospital related costs. And they're going to have to pay your Part B, which is your medical costs, your labs, all of those things are included in the Medicare Advantage plan. But to entice you, they give you a little bit more to join a plan.
Okay. Okay.
Mm-hmm.
Okay. Yeah. All right. Thank you so much. Because from at least I really work in the policy area of things. So
Right,
like the term supplemental benefits I use, but it's the extra benefits. And as you said, from a consumer standpoint, you may
right.
easily confuse supplemental benefits with Medicare supplement. Um,
Because
yeah.
I get it all the time, so I know,
Yes.
I know they
Yeah.
folks do that.
Yeah. So pretty much, all right, I signed up for a Medicare Advantage plan.
Right.
I'm using my medical and my hospital stuff, but I'm
Mm-hmm.
probably not using my extra benefits.
Correct.
Within the year, I will get a notification from a health plan reminding me that, Prince, you have some dental or vision or some other supplemental benefits.
Right.
Have you forgotten, or have you? So if somebody receives such a letter in the middle of the year, it's not a mistake. It's not
It's
like
not a
that you're
mistake.
expecting it.
This is the first time they're gonna get this, but it's not a mistake.
Okay.
It's just making sure that they take advantage of what's available to them.
Available. Okay. 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 Awesome. Thank you so much. Anything else
Mhm.
more?
For this, no.
Okay. All right. I'll go on to the next page.
So I think we covered some of this, Prince, but part of it is why this is important, right? And I mentioned the fact of these extra benefits or supplemental benefits, whatever the term that you want to call them. It's a big decision. It's part of the decision making that an individual would often make, right? So when someone sits with me and we're going over their needs assessment and what is it they want from Medicare, they're going to tell me, oh, I would love to have some dental.
Mm,
Oh, I have some procedures to have done this year, and I
okay.
need dental coverage, for example, right? So
Hmm.
that's part of the decision in having someone go with a Medicare um, Advantage plan that includes dental, for example,
Okay.
versus a Medicare supplement with original Medicare, because since that's not a covered benefit under original Medicare, chances are that individual, if they need dental, they're going to have to buy a separate
Great.
dental plan.
Okay.
So it's part of the bigger decision making. That's why I say to folks, it's not all black and white in when it comes to original Medicare versus Medicare Advantage. Individuals have certain things that they're looking at. And if you're doing a good job of trying to understand what the consumer needs, then it makes sense to know which plan will be better for them or which choice pathway to take would be best for them based on their needs.
Based on the needs. Okay.
Mm-hmm.
Okay.
Yeah.
Thank you. Um, so how to make Medicare Advantage work for you? How does one make sure, the plan that I selected during this year, I take advantage of the plan as much as possible to my
Mm-hmm.
needs?
Well, there are a few ways to do that. And one of the ways, obviously, if you move to the other slide,
I'm fine. Okay.
is really to review their annual notice of change. This is their ANOC document. So you want to review that plan, that
Hmm.
document, very closely. Um, I know for a fact that there are lots of changes on the ANOCs.
Okay.
Some people might have to make some decisions as it pertains to whether or not they the plan will continue next year or not. So that's one of the things that they want to do, right? Check the ANOCs. The second thing they want to do is you want to, when it comes to Medicare Advantage, you want to check your plan network to see if your doctors are going to be in network, right? So you want to check to take all the names of your doctor and don't just limit it to your primary care physician, because I think that's where folks make the biggest mistake, is giving the broker that they're working with just their primary care doctor.
Okay.
And when they're doing that, they're really missing the boat here, so to speak, because then a few months later, they're going to go to a specialist and they're going to come back always and say, well, Ruthlin, my specialist, my GYN or my cardiologist, they're not a network for that plan that I have. And then we need to scramble. And some people cannot change their Medicare plans mid-year, right? Because they
Yeah.
don't have a special enrollment that we went over previously. So it's very important that if you think you're going to see a doctor, make sure that you, and this is the doctor, first of all, this is the doctor you want to keep, right? Make sure that that doctor is in network for the plan. And
Mm.
let's say it's a PPO plan, right? Preferred provider organizational plan, and you do have the ability to go out of network. You want to make sure too that if you go out of network, what are you going to pay? Because maybe you may not want to go out of network at all because the costs are much higher when you go out of network. So it's important to check those doctors against the actual plans that you're looking at.
You're looking at. Okay. Okay.
Right?
So pretty much, I think as a last week when we're discussing the Part D, the annual notice of change document seems to be like
It's your Bible, so
your
to speak. It's your guiding document as
yeah,
to what's
yeah,
going to happen in 2025.
yeah. And for that preparation of knowing your need and
Right.
knowing what medications you're taking or what providers that you want to keep, and as you
Correct.
said, providers you're using now that you want to keep in the future in the next 2025, want to
Correct.
make sure that they are in network as you work
Right.
along and making yourself ready
Correct.
for the
Correct. And let me point out that this annual enrollment period, it's really about the people that already have Medicare, right?
Medicare.
So
Yeah.
if someone is brand new to Medicare or they're coming into Medicare um, November or December, they actually going through what they call their initial enrollment period. So this is really about people who already have Medicare. Maybe they enrolled in a Part D drug plan or a or Medicare Advantage plan, and so now they get to make some changes as it pertains to that. So pay close attention to those ANOCs.
Okay. Okay. Do just a quick question. If you are getting into your initial enrollment period,
Mm-hmm.
you don't receive an INOC, right? Or do you?
You won't receive if you're getting into, you might get it back to back, right? Because let's say you're enrolling in November, right?
Okay.
Your birthday is sometime in November, so November 1st is your birthday, is your initial enrollment for Medicare. Well, you're
Okay.
coming in before the end of the year. So you get to get your initial enrollment because the plans, you might actually select a plan for 24. But
Okay.
then remember, everything resets at the end of the year. So if the plan that you selected in November, that will run from November through December, is changing for 2025, you need to know that as well because you're going to stuck. So you're going to get those two back to back
Okay.
as
Okay.
well.
Okay. Thank you so much. And
Mm-hmm.
for our audience, like just as we were doing last week, if you have any question, don't hesitate to put your question in the chat box of the social media channel that you are watching from, either from Facebook, on LinkedIn, or YouTube, because it comes here and then we can look at the question or we can show it on the screen and
Mm-hmm.
discuss
Mm-hmm.
it accordingly. So I wanted to remind our audience who are joining us, or if you are new joining us, I want to let you also know. So thank you, Rutlin. Do you want to continue on what our audience need to know as we
Okay.
to
All
2020?
right. So one of the questions I get asked so much is that, oh, well, I thought insulin was $35. Why am I paying more? um and this comes throughout the year, right? And then the other one is, oh, I use one of those monitors to check my blood glucose levels, the devices that you put on your arm or on your stomach, wherever. Those are called continuous glucose monitors, right?
Okay.
CGMs. And so you use those devices, and folks will say to me, oh, my physician gave me a script and I took the script to the pharmacist and they're not covered. And
Hmm.
so I want to emphasize to folks that, well, two things. With the insulin products, not every insulin product is going to be covered for every carrier or every
Okay.
plan, right? So if you're on an insulin product that's not currently covered, you may have to switch or move to a product that's on that plan's formulary, or you may have to get your doctor to go through the process of prior approval, or if they have step therapy, but they have to demonstrate that you have a medical need. So you might get it for the first couple of months, but then you may have to change. So I want to point that out to folks,
Ah.
because that is very important, because you might be on a product that's not covered. um, with the continuous glucose monitors, those are treated as devices, right?
Okay.
So your doctor should not be giving you a prescription to take it to the pharmacy, because that's covered under a Part B, as in technically Medicare Part B benefit for devices. So what the doctor has to do is submit for prior approval,
Okay.
right? And I will tell you that most of the brands are covered on for a carrier. But if your brand is not covered, the carrier still has to service the device, right? So they may want you to go onto a brand, a type of product that they have on their formulary. Don't be
Okay.
too resistant to that, right? Especially on the CGM. You work with the plan, it's going to work well for you. But if
Okay.
you want to keep using something that's not covered, or they're not covered, or however they do their setup, then you may end up spending money, significant money out of pocket for things that you do not have to pay significant money for. So know how those things are covered. And when you're sitting down with someone, and if you know you're on insulin or you know you have a CGM product, ask the agent, ask the plan that you're calling directly, ask them how those things are covered for the plans that they're recommending.
Okay. 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 That's very important. And even with the idea, because the idea that those prescriptions are not the prescriptions, because the doctor who writes the prescriptions, the doctor that wrote that for you, and from a consumer standpoint,
Right,
I'm going to the same CVS to pick this thing up, right? But
right.
how it is covered in the back end and how these things go may totally change where who is paying for it and how that
Correct,
affects you. Yeah.
correct.
So
And we're so used,
okay.
when you think about it, we're so used to just getting a script from our doctor, and then we go to the pharmacy to pick it up,
Mhm.
right? But
Yeah.
those things may not be covered under the pharmacy benefit, right?
Mhm.
So you got to be very careful. And I bring this up because, Prince, I can't tell you the number one issue. Well, the number one and two issues that we deal with, for consumers, is that
Customers.
they will call me and say, "Well, Ruthlyn, my CGM is not covered." And the doctor says it's supposed to be covered, and my pharmacist is saying no. And I said, "Well, tell me a little bit about how you end up knowing that it's not covered, right?"
Hmm.
And they'll say, "Okay, my doctor gave me a script and I take it to my pharmacy." And I'm like, "No, no, no." Especially on the CGMs, the doctor have to submit it through medical necessity, right?
Hmm.
Because there are criteria that they have to show that you meet those criterias. Even if you've been on those medications for 5 years, when you come onto Medicare, this is a new plan, right? Or if you've been on Medicare for the year, this is a new plan, new setup. They still have guidelines and requirements. It's why it's called managed care, right? But pay close attention. So it's not that it's not covered, it might be covered differently.
Differently. Okay. 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 Thank you so much for that explanation on that one as well. I think you still have some things. Oh, I think we just the
Okay.
maximum. Yep.
Yes. All right. So one of the things that's on Medicare this year, that I've noticed, is that the maximum out of pocket limit for medical has went up a bit. So we
Okay.
spoke about the fact that Medicaid, the Part
Part
D
D.
section, the prescription section, out of pocket costs went down to $2,000, but the medical out of pockets, I've noticed, not on all plans, but on some of the plans, have went up. And so folks need to know what their maximum is that they're going to pay for medical, right? And I want to remind folks that you do have two sets of out of pocket limits on Medicare Advantage plans. You have a medical out of pocket maximum, it's called a MOOP, and you might hear it referred to as that. And you have a prescription under the Part D benefits, out of pocket limit. So we know Part D is $2,000, but your medical might be 6,000, it might be 5,000, or it might be over $9,000.
Huh.
So you need to know what you're paying out of pocket for medical,
Hmm. Okay.
right?
Okay. All right. So it's more of like now with the I know we went on the part D
Right.
last time, and we are talking more on the part A B bundled together C. So knowing the out of pocket for both of them and trying to
It's important.
working through all of them with either a broker or somebody to understand comprehensively at the end of the day what is the overall that you are looking at, not necessarily one or the other.
Mm-hmm.
Because at the end of the day, you go to a provider, they write a script for you. Your part D and part A and B, your medical side, all add together from your pocket that is coming out. So knowing
And
those,
and really and truly, Prince, it doesn't really add together. It's not treated as added from a consumer standpoint. You're going to add your numbers because you're gonna say, okay, if I have $2,000 limit for prescription and then I have $6,000 that I have to pay out of pocket for medical, then
Mhm.
technically, I'm out $8,000. From a consumer standpoint, we tend to
Yes,
do that. But those two are really treated separately.
really.
And that's where, with Medicare Advantage, individuals, you need to know how you're going to use your Medicare Advantage, right? Because maybe you have a lot of medical, you're more likely to use more medical because you have lots of doctors that you're seeing. So you want to make sure that your costs are done on the medical side, but maybe you have only one medication on the prescription, right? So the impact varies based on individual needs. That's why we always have to get a sense as to how an individual
Use
is
service.
going to use their Medicare Advantage plans when it comes to medical and when it comes to prescription drug plans. And I want to add something here too, because we spoke previously about the $2,000
Hmm.
for the Part D, but the $2,000 is also applied to the prescription benefits under the Medicare Advantage plans as well.
All
So,
right, hold on. So the 2000 is also applied to the prescriptions under the Part B,
correct,
like the medical. Okay. Oh, wow.
correct. And that's because Medicare Advantage plans, not only do they cover medical, many of them include
The Part
in
B.
the medical, you're paying one price, one premium, but part of that includes the prescription drug benefit. So the
Okay.
same thing we said for the standalone is the same thing we're going to say here, that $2,000 applies to the prescription drug benefit under a Medicare
Medicare
Advantage plan
Advantage.
as well,
Okay.
which
Okay.
also means, Prince, that the donut hole goes away under those Medicare Advantage plans as well.
Okay.
All
Okay.
right.
Okay. Okay. Thank you so much for that explanation. Yeah, I had to pause you for so that I emphasize that. Yeah, but thank you so much for that explanation.
Mm-hmm.
Um, I think there are still extra
Oh,
benefits.
sorry. Go back one more page.
Go
I
back
wanted
one
to
more.
talk about.
Okay.
I just realized I had to talk about the deductible as well.
Okay.
So some of the other costs that individuals are going to look for under the Medicare Advantage plans. We spoke about the Part D deductible. That
Mm-hmm.
some of the plans may have $590 in a deductible that they have to pay for prescription, right?
Mm-hmm.
Some of the plans may also have a deductible on medical. Not that it's a bad plan if you have a deductible, you have to know what's excluded from the medical deductible. So, oftentimes, when it comes to Medicare Advantage plans that includes a deductible on it, what you will find is that the deductible may exclude things like your physician visits or your
Okay.
specialist visits, right? But what's included might be if you go to a hospital and you have an inpatient hospital stay, then you may trigger the deductible. And so
Okay.
you'll have to pay that in addition to your copays until you satisfy the deductible, and then they'll start paying the copays as it lays out in the plan. So it's important that if individuals are choosing a Medicare Advantage plan with a deductible, know exactly what's covered under the deductible.
Okay. 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 Yeah, because now it's more of looking at your costs from a comprehensive
Correct,
standpoint, right?
correct,
And how
correct.
these costs are being
Right.
shared across.
Because when I hear someone says to me, "Oh, I hate this plan. Oh, I'm going to the doctor. I just had a hospital stay, and on top of my hospital stay, I'm told I have to pay this deductible." That's what's triggering it, right? You're supposed to know what your deductibles from medical is going to be and where it's triggered, right? And of course, I say to everyone, understand your copays, right? We know that the Medicare Advantage plans have copays. right? Whether it's $20 for a primary care physician, but $45 for a specialist, or $200 for radiology, or whatever other visits that you have to take, you know how those are covered. So if you have a deductible, you'll pay a deductible on top of your copay when you go through certain services. Now, the good news is that you'll never pay more than what the maximum out of pocket for medical is. So once you've hit that maximum limit, if you hit it in February, right off the bat, because maybe you've had a lot of you have illnesses and other things. So if you hit the medical maximum, let's say the end of February, for the rest of the year, all you're doing, you have no more payments to
More
make because
payments.
you've reached the maximum, right? So it's when you hit it. The fact is that most people won't ever hit it. Most beneficiaries will never get to the maximum out of pocket. So we're stuck paying deductibles,
Mm-hmm.
paying our co-pays for services when we're dealing with the Medicare Advantage plans.
Yeah. Yeah, thank you so much for that explanation. We also
Mhm.
want to I also want to emphasize again, if you have any question, feel free to put it in the chat, and we will have it here as we go through it and discuss through this. Um, all right, I think going on to the extra benefits that you touched on earlier.
Right, right. So I don't want folks to be making decisions about their Medicare just on their extra benefits. You want to look at it from a larger perspective, right? What are my medical needs? What are my pharmaceutical needs? And oh yeah, great. I might need some dental. How much dental do I need? Because if you just focus on the extra benefits, and where it's a problem I've seen is when the over the counter benefits, right? This is the money put on a card by the plans, right? That you could use on things like healthy meals, or you could use it to buy non-prescription drugs, those kind of things. Now, the OTC might look great, but then you might have a network issue
Hmm.
with your doctors because you might have great OTC benefits, but now you're having a problem with accessing your doctor because the type of plan that has high OTC benefits may not have a robust network.
Hmm.
So you want to make sure that you're looking at all of those in the context of
Yeah.
what are my needs, right? So that's all I'm gonna say about the extra benefits. Because they're appealing. They're very appealing. I know I have folks call me and say, Ruthlin, how do I get the extra benefits?
Hmm.
Right? And we never start there with with things. So if someone comes with us with that, we're gonna say yes, there are extra benefits available, but let's take a step back and let's make sure that the entire plan works for you. And then if extra benefits are included, then great. And if it's not, well, let's look at some other ways to make the plan work for you. But when you hear folks saying about, oh, I hate Medicare, and they do use those strong language, a lot of times they're not looking at it from a rounded picture.
Yeah, yeah.
Mm,
We do have a question that came in from YouTube, and it says, if you have any, um, I think it's a typo. If you have any medical insurance somewhere else, can you still get Medicaid at the same time? Oh, so there's a question on
okay.
Medicaid.
All right.
I don't know if you can speak to it, or
So we're
you
going to the next slide, I believe, where we talk
will
about
have. Okay,
Medicaid, right? Because we
okay.
use it as cost savings
Uh-huh.
for individuals. So this question could actually be one of two things, right? One meaning that the individual might have medical insurance, maybe a secondary coverage through an employer plan or something else. So if it's a secondary coverage issue, they want to know if they could still you get Medicaid. So Medicaid is treated as long-term care services for many individuals. But Medicaid also has limits. It has income limits, and it has resource limits, meaning how much money you have in the bank, how much money you have in 401ks. They're going to count those as well as your expenses to see if you could meet the Medicaid limit. But Medicaid is the most comprehensive when we're looking at saving money for individuals on Medicare, and that's whether they have a Medicare original Medicare plan or they have a Medicare Advantage plan, Medicaid is the first tool we look at to offer secondary coverage, because if you're able to qualify for Medicaid, then chances are that Medicaid is going to cover almost 100% of all of your out of pocket costs. So, Medicare is one tool that we have in our arsenal to see if someone qualifies. So, I always say to individuals, and every state is different. I'm here in New York. New York is more of a generous state than some of the southern states that we work in. But yes, if someone have a need, chances are, and it's a long-term health care need, chances are Medicaid could be used. Well, it's long-term care, but it's also financial. I want to put both of those in there. So if the need is just financial, you can't afford your coverage, obviously, but your income is low enough, what you're getting from your Social Security payments and your pensions, if you have any pension plans, is low enough, you could qualify for Medicaid just based on financial needs. But for someone who needs long-term care, and we do this for our teams, right? We help with the Medicaid applications. But if someone needs long-term care services, they need an aid in the home, Medicaid is the largest payer that provides those services. And so there are steps to getting the individual qualified for Medicaid.
Yeah,
Yeah.
and even within the context of what we're talking about in Medicare,
Mm-hmm.
so if you qualify for dual, and I think you touched on last week, and you're probably going to touch on
Right,
today too.
right. So the dual plans, Prince, is a type of Medicare Advantage plan,
Hmm.
right? That kind of leverage the Medicaid. So individuals qualify for both Medicaid and Medicare. So they're getting some of those benefits through the managed Medicare plan.
Hmm.
But that doesn't stop an individual from getting long-term care directly from the state as well, right?
Okay.
So the Medicare plan will cover the DSNP, the dual special needs plan, or those plans will cover um, the individual medical needs because Medicare is primary for them. And then Medicaid will take in secondary and cover anything else
Else.
that they need, which includes the long-term care.
Okay.
And it's a tool we use because here in New York, we have a large number of people that could qualify for long term care. They just need help and guidance going through the Medicaid paperwork because it's super extensive, right? um, so Medicaid is what we look at first. If
Okay.
someone, and before I even come off Medicaid, I want to say this. If someone is eligible for Medicaid, and you qualify, you go through the paperwork and you qualify for Medicaid, then you do not need a Medicare supplement, right? And I see people making those mistakes all the time, right? So, with original Medicare,
Hmm.
we add a supplement to pay our out of pocket costs, but we know that supplements are expensive. And I see people come into us all the time and they have a Medicare supplement policy that they're paying $300-$400 for per month, and they're cash strapped. They cannot afford anything else. Um, Medicaid, the supplement is technically secondary, kind of help you pay the copays, right? But if you have a supplement and Medicaid is paying the same cost, what good is the
Okay.
supplement? Right? So think about that when it comes to Medicaid because it's a tool we use in our arsenal to help individuals afford their Medicare costs.
Okay.
This the second program that the government um, has available for individuals as well is called a Medicare Savings Program, or MSP for short. And that program is for people who makes a little too much to qualify for Medicaid, but their income is not so high and they don't have a lot of resources either, right? They don't have tons, thousands of dollars sitting in a in pensions and stuff that they could use to kind of pay down their costs, right? So the Medicare savings is another tool, and I will tell you the vast majority of Medicare beneficiaries don't think that they qualify for the Medicare savings program. The government is telling us that large swaths of people qualify for those programs. So if you're working with a broker and the broker is looking at the Medicaid, you're going to look at Medicaid first. And if your numbers are too high, the next program they should look at is the Medicare Savings Program, because Prince, here is what the Medicare Savings Program do. It pays your premium
Hmm.
for Medicare Part B, as most people have that premium for Part B, and could help pay copays and deductibles and everything else for some other people. They have multiple programs under the Medicare Savings Program, but it's a tool to look at to get your help, your costs paid as well,
Huh. Huh.
right? So it does almost the same thing as Medicaid,
Medicaid.
right? And in fact, those two programs, eligibility for Medicaid and the Medicare Savings Program, is what determines if someone would qualify for the dual special needs plan,
Hmm.
right?
Hmm. Yeah.
Um, but someone could technically not have a lot of resources and still qualify for the Medicare Savings Program, and may not even have Medicaid. So
Medicaid.
it's a
Okay.
tool in the arsenal.
Okay. Okay.
Then, once you've exhausted both of those, right, you're going to your state programs. Many states have pharmaceutical assistance programs. You want to look there to see what kind of opportunities they have for you to enroll. All of these programs go back to what's called Medicare extra benefits. And that's a way to, as the pharmaceutical helps, the name says it all, helps you pay
Wonderful.
for your prescription benefits. So there are options there as well. And then lastly, explore when it comes to Medicare Advantage in your state, hospital indemnities and some of the other voluntary, and I'm going to call voluntary benefits that will pay you cash if you have a medical situation. Maybe you go to the hospital inpatient, it pays you cash. You use the cash to supplement your out of pocket costs that you had. So those are available. I don't say start with the voluntary benefits. I say start and see if you qualify with Medicaid and go down the list and check those out, to see what you might be eligible for.
Okay. Okay.
Mhm.
Thank you so much. Because usually, the cost becomes a burden, and
Mhm.
knowing what options and what levels of elimination one can go through in helping with some of the costs is
Right.
always
Right.
appreciated and very helpful. And thank you so much, Miss Alice, for your question. And we hope that we were able to touch on and answer the question
Right.
for you in that way.
And let me just add very quickly too
Go
that
ahead.
maybe this individual has coverage through an employer plan.
Employer.
Maybe they didn't come onto. If the income is there and they need long-term care support, they could still qualify for Medicaid for long-term care support in most states. So you want to explore all of the options when it comes to Medicaid.
Yeah. Thank
All
you so
right.
much. All right. Yeah, and I think getting the benefits checkup, we have only 2 minutes, so please go ahead.
Well, it is what it is, right? It's open enrollment season.
Yeah.
We're clearly offering, benefit checkups to the states that we're licensed in and work with individuals. But my team would be happy if someone contact us to refer them to someone in the states that we do not work in. I always say to folks, make sure you're talking with someone who is certified and appointed to assist with Medicare Advantage and the Part D drug plans.
Thank you so much. Miss Alice has another follow-up question here asking about, let me quickly show it if you don't mind. How can you apply for Medicaid savings?
Okay. Usually, so the Medicare Savings Program is often run by the state.
States.
Medicare has an extra help application, but most states do coordination with the extra help. So you would normally go through either your Department of Social Services, maybe because it's run often by the same program that administers the Medicaid program in your state, or it might be by the elderly. They usually have like an elderly program on the state side that might be taking the application. It varies by state, but if she wants to shoot out something to us, we could definitely, and we know what state she's in, I could definitely refer her back to the state that she's in so she could see the application, and could work through the application. Some applications are one page, others are 15 pages, right?
Depending on the state, right?
but it's available, and it's a resource available to your state. So you could also just Google Medicare Savings Program
For the
in the
state.
state of Virginia, for example.
Yeah.
Hmm.
Yeah. Thank you so much. And Miss Alice, we're gonna have our contact information here. So as Ruthlin said, if there are any questions or anything follow up wise, um, you can reach out to either Ruthlin with her email or go to her website, or either reach out to me on the Hills Academy side, and we would be happy to talk through some of these to navigate to the right place. So thank you again. Any last words for us, Ruthlin, before we hit next week? Uh,
Thank you. Next week, we're like a day before open enrollment, so they should be exciting. So it'll
mhm.
just be a refresher, right?
Yeah. And I want to always thank you for your knowledge, for your time, and for our audience. Want to thank you all so much for joining and tuning in here today with us. And we hope to see you all next week. And thank you. My wife has been helping in the background with getting this production going. So I also want to say a shout out to her for making the production possible as well. So thank you. And we hope to see everybody next week as we finalize. Invite your friends, invite your family, learn. Even if you're not Medicare eligible right now, at least this information makes it familiar to you so that by the time you get there, you are ready. Uh, before even you get there. So thank you again, and we hope to see you all next week as we finalize Medicare Mondays for 2024 for the 2025 enrollment season. Thank you again, and we'll catch you all next week. Bye for now.